So our first question, how would you advise medical students who are currently undecided on a specialty to choose their medical field? Dr. Jamshed, would you like to comment on this?
Sure, thank you for that question. I typically, well, first of all, depending on which year they are, it may make a difference because if they haven't had enough clinical rotations, yeah, I encourage them to keep an open mind. But typically, this happens around third year or end of third year, and we start talking about what they don't want to do first, and we start taking that out. A lot of the specialty choices actually depend on the medical school you're at as well. So you have programs that have a lot of strength and residents who are teaching you, and that excites you. And honestly, you should follow your dreams. If you whatever you want to do, you should do that.
That's great. Dr. Qureshi, would you like to comment?
I think it's a bit of the luck of the draw, and I agree with Namira. It's incredible how, depending on what your first rotation is or what your last rotation is, a lot of the medical students end up gravitating towards those specialties, unless there's a horrible experience. That's number one. Number two, I think the people around you make a big difference. If you're excited by your faculty member or the residents who are on service with you, that's what you're going to get attracted to. There is a subset of medical students who at least say, I was born to do XYZ. And yes and no, sure, you can self-select out. I think whatever excites you, you'll know. When you wake up in the morning and you start thinking about your patients or how your day is going to be that particular day, and you are engaged very early on, you'll know very quickly what you want to do. And I agree with Namira. There will be some things you will absolutely hate, and you'll say, I will never do this no matter what, even if you're having fun, but you just don't like that lifestyle. And yeah, definitely follow your dreams, but be realistic, right? If you're going to spend a week on ophthalmology and you haven't made any network or connections, and you want to do ophthalmology and you've done no work since your week of ophthalmology, that's going to be a little challenging. So you have to be realistic at the same time.
All right, great answer.